Welcome to this visual introduction to the Integrated Plan of Care process, which was developed by the Ottawa Service Collaborative. Now you are probably wondering, what is the Integrated Plan of Care process and who is the Ottawa Service Collaborative? To answer these questions, we'll first backtrack to give you some context. So 25 years of government reports in Ontario, the Graham Report, Putting People First, Making It Happen, Realizing Potential, and Every Door is the Right Door all identified the need for better system coordination in mental health and/or addiction service delivery. In 2011, the Ontario government released Open Minds, Healthy Minds. This strategy outlines how the mental health and addiction systems will be transformed to improve services for everyone in Ontario. For the first 3 years, the focus is on children and youth, including families. Systems improvement through service collaboratives is one of the initiatives under the comprehensive strategy. To make the service collaboratives happen, 6 provincial ministries came together: the Ministry of Health and Long-Term Care, the Ministry of Children and Youth Services, the Ministry of Education, the Ministry of Training, Colleges and Universities, the Ministry of the Attorney General, and the Ministry of Community Safety and Correctional Services. These 6 ministries are working with the Centre for Addiction and Mental Health. They have established 18 service collaboratives across Ontario. But what is a service collaborative? A service collaborative is a group of people working together to identify a system gap in their community and then figure out what to do about it to make things better. Members include service providers from different areas that work with children and youth, including education, mental health, addictions, youth justice, and child welfare. Some services are in the community and others are in hospitals. Other services focus on specific populations, such as working with Francophone or First Nations, Inuit, and Métis children and youth. Youth and family members with lived experience are also important members of the service collaboratives. So what does all of this have to do with Ottawa? The Ottawa Service Collaborative was one of the first service collaboratives created and brought together people with lived experience and service providers from 22 agencies and organizations, including those serving our identified priority populations: Francophone, First Nations, Inuit, and Métis children, youth, and families. When the Ottawa Service Collaborative got together, we had to choose a single system gap to work on. There were many to choose from, but we decided to focus on the continuity of care for children and youth with complex needs and their families. Next, we had to figure out what we were going to do about this. We looked at programs and services that work in other communities to create continuity of care. Programs like the Single Plan of Care approach in Simcoe, York, and the Community Intervention Planning Pilot Project in Ottawa. Working from these, we created the Integrated Plan of Care process as our intervention. So what is the Integrated Plan of Care process, also known as the IPC process? It's for children and youth whose needs cover health, mental health and addictions, and social issues, leading to major challenges participating meaningfully in society. They have worked or are working with 2 or more services from different sectors. The child or youth is experiencing minimal success with their services, and they are at serious risk of harming themselves and/or others. The IPC process takes a team approach to get everyone working together to help children and youth achieve their care and life goals. Service providers and family members support the child or youth to overcome the obstacles in their path by focusing on their needs and strengths. So how does all of this work? A service provider will identify and refer their client to the IPC process, and then bring together a team of service providers from different organizations and agencies to work as equal partners with the child or youth and their family. One member of the team is identified as the main point of contact for the client and will guide the implementation of the plan of care. Central to all of this is the child or youth. They take the lead in creating their plan of care with the support of their service provider team and family. The family plays a key role in supporting the client to communicate their vision and goals for the plan of care and be actively involved in achieving these goals. The goals identified by the child or youth are recorded on the Integrated Plan of Care template. Goals can be from many areas. The team members and supports needed to achieve these goals are also written into the Integrated Plan of Care, so that it is clear to everyone who is doing what. The IPC process is supported by research and was created to fit the specific needs of the Ottawa community in order to improve continuity of care. It is inclusive of the unique strengths and needs of the Francophone and First Nations, Inuit, and Métis children and youth culture and language. That's it for a brief overview of service collaboratives and the IPC process. But if you would like more information, please visit our website.